Welcome back to the deep dive. This is where we take all those sources you send over and really pull out the key insights, the stuff you can actually use.
Yep, the actionable intelligence.
Exactly. So today we're digging into Dr. Andrew Weil's book, Ending Illness, or Payani Bamari. It's pretty influential stuff.
Oh, definitely. It really makes you rethink, how we approach health altogether. Weil's argument sort of challenges that standard model.
The one where you wait to get sick and then, boom, pharmaceuticals.
Right. He's saying, look, a lot of these chronic diseases, they aren't just bad genes or, catching a virus. They often build up over years because of, how we live.
Okay, so that's our mission today, isn't it? Can we genuinely prevent, maybe even treat or reverse things like diabetes or heart disease just by changing our lifestyle? And we want to get practical here, right? Not just the theory, but the how. What's the evidence?
And that's the value here for you, the listener. Weil lays out this whole system, backed by evidence. He connects the dots, between your daily habits, what you eat, how you move, how you think, and where your health is headed long term.
Okay, so let's hook you right away with this. Remember that type 2 diabetes study mentioned in the sources?
Oh, yeah, that one's a powerful example.
Seriously, we're talking about patients who made some really focused changes, no new drugs, just a big diet overhaul and getting more active every day.
And the result wasn't just like slightly better blood sugar?
No, it was some patients getting to the point where they didn't need their medication at all anymore.
Completely off it.
Yeah.
And the sources suggest that shift to whole foods, lots of plants, that was really crucial. It just shows, the body's amazing ability to heal itself, to re-regulate if you give it the right stuff.
Yeah.
More than we usually assume.
It's a huge shift, isn't it? From just managing symptoms to actually aiming for, fixing the system. Okay, let's start mapping out Weil's framework.
Where does he begin?
Well, fundamentally, his whole approach is about taking back control, not just handing your health over to someone else. He argues pretty strongly that prevention is always better than cure.
Makes sense.
And if most illness comes from lifestyle choices that aren't quite right, then the power to change things is actually with us.
Right. And he boils this down to 3 core ideas, 3 pillars that all work together. You can't really separate them. It's nutrition, movement, and stress management or mindset.
Interconnected, you said.
Absolutely interconnected. Think of it like a feedback loop. If your diet causes inflammation, that makes stress worse. If you don't move enough, your body can't handle stress hormones as well. It all ties together.
Okay, let's drill down into pillar 1 then. Nutrition. Weil isn't just saying eat healthy, is he? He gets specific.
He does. He really emphasizes natural, plant-based foods. Lots of raw materials, vegetables, fruits, the unprocessed stuff.
And the warning, what's he flagging as the big problem?
Oh, definitely processed foods, way too much sugar, saturated fats. He points to these as major drivers, basically feeding the inflammation that underlies so many chronic illnesses, diabetes, heart disease, maybe even some cancers.
So it's about calming that internal inflammation.
Exactly. You're calming the systemic storm, so to speak. Plus, eating whole plant foods feeds your gut microbiome, which we're learning is just central to everything, immune system, mood, you name it.
Right. So it's way beyond just counting calories. It's about body chemistry. And the sources show this working in practice. There was that example with the hypertension patients, high blood pressure.
Yes, that group.
Yeah.
The intervention was mainly diet. Cut the salt way down, increase foods rich in things like potassium, magnesium, stuff that helps relax blood vessels naturally.
And the results?
Pretty remarkable. Many patients saw their blood pressure drop back into the normal, healthy range. And this wasn't just, helping the meds work better. For some, the diet was the main treatment that worked.
Okay, but let's pause there for a second. For you listening, wanting actionable stuff, are we sure diet alone did this? Or were these people still getting, medical checkups, maybe some drug adjustments during this change?
That's a fair point, a necessary one. The study's Weil uses highlight diet as the primary driver for getting things back to normal. Often, patients could reduce or stop meds because the diet was working so well.
Okay.
So the point isn't really throw away all medicine. It's more like establishing diet as potentially the most powerful first step. Nutrition becomes like a measurable medicine in this context. It changes the body's internal environment.
Got it. Okay, so we fueled the body, but it's not just a passive container, right? It needs movement. That brings us to the next pillars.
Pillars 2 and 3. And they really do work hand in hand. The physical and the mental approach.
So, pillar 2, movement, exercise.
Yeah, and this one's pretty straightforward, but also foundational. Weil emphasizes consistency over, say, crazy intensity. He points out that regular activity, honestly, even just 30 minutes of walking a day, significantly cuts your risk for the big chronic diseases.
Well,
Heart problems, diabetes, certain cancers.
that's incredibly accessible, isn't it? 30 minutes of walking, most people could aim for that.
Right. And the sources connect the dots here, too. There was that patient example. Someone started doing that daily 30-minute walk.
Yeah.
And they didn't just see improvements in heart health markers. They also reported feeling significantly less stressed, less anxious. So it's the physical action with, like, immediate mental benefits.
Why does that happen? What's the mechanism?
Well, regular movement is one of the best ways we know to regulate the HPA axis. That's the body's main stress response system. Exercise helps burn off those excess stress hormones, like cortisol, before they hang around and cause chronic damage.
Which leads us perfectly into pillar 3, stress and mindset. Because if the body makes stress hormones,
it needs ways to deal with them, to switch them off. Weil argues that chronic stress is often the way in, the vulnerability point, for both physical illness and mental health struggles.
So what are the solutions he offers?
He recommends practices that deliberately activate the rest and digest system, the parasympathetic nervous system, things like yoga, specific breathing techniques, meditation, low impact but high return methods.
And this isn't just, feeling calm. There's actual science here. The sources mentioned a specific study on meditation.
Yes. A group practiced mindfulness meditation for just 10 minutes a day. Short.
Very short.
And they measured not just lower reported stress levels, but actual observable strengthening of the immune system function.
Wow.
Right.
So a simple mental practice directly impacts physical defenses.
Exactly. It shows that mind-body connection isn't just a nice idea, it's tangible. You're basically using your mind to trigger your body's own internal pharmacy, strengthening your defenses.
That whole concept, the mind and body being totally linked, affecting each other constantly, that seems to be a huge running theme in ending illness, doesn't it?
Oh, absolutely. It's central. He really emphasizes the active role your attitude, your mindset plays in healing.
It's not just a side effect.
No, he argues the mind isn't just passively experiencing illness. It's an active participant in getting better. A positive outlook isn't just about, staying cheerful. It seems to be biologically important for healing effectively.
And the cancer patient study highlighted in the sources really drives this home.
It does. It found that patients who approached their illness with a more proactive, positive, or resilient mindset generally had a better treatment path, better outcomes, compared to those who felt maybe more negative or resigned.
So the implication is massive. Your mental state is actually a factor alongside the chemo or the surgery.
It seems so. Our mindset, our will. They seem to influence things like inflammation and hormones in ways that really affect how well we respond to medical treatment.
And when you put all 3 pillars together, the nutrition, the movement, the mindset,
the impact is synergistic, it's comprehensive. Like that case study mentioned, the patient struggling with severe anxiety and depression.
Right, what happened there?
They went all in, they adopted the whole strategy, regular exercise, big dietary changes, plus psychological support. And they saw improvements not just mentally in the anxiety and depression, but also in related physical problems that hadn't responded well before to just one treatment alone.
So Weil's lesson is really about seeing health as a whole system.
Exactly. Trying to treat just one symptom, like anxiety with only a pill, while ignoring diet or movement. It often falls short because you're not addressing the root imbalance in the whole system.
Okay, so we've got the framework, we've seen the evidence, the examples. For you listening, trying to figure out if this is credible, we need to ask, what makes Weil's approach feel scientifically solid and not just, a collection of stories?
I think its main strength is how it's structured. Well, carefully blends his own decades of clinical experience, what he actually saw, work with patients with solid, published scientific research and studies. He's not just making claims. He's connecting observable physiological changes to established science. It might seem unconventional in some ways, but it's grounded.
And it feels very practical too, right? The things he suggests aren't usually high-tech or super expensive.
That's a huge plus. It's about simple daily things.
Yeah.
Changing your food, walking, breathing. That accessibility makes it feel achievable for a lot of people.
Okay, but let's push back a bit. If this approach is so effective, why isn't everyone doing it? What are the real hurdles, the challenges that maybe the book doesn't fully capture?
Well, the biggest one is probably obvious, but it's commitment. Sustained long-term commitment. It takes serious willpower to fundamentally change habits you've had your whole life.
Like completely switching from a standard American diet to mostly plants.
Exactly. That's not a quick fix. It's a major lifestyle overhaul. It can be difficult, sometimes more expensive depending on where you live, and even socially isolating sometimes. It's a big ask.
And beyond just willpower, are there actual medical reasons why this might not be the whole answer for everyone? Say, someone with a complex autoimmune disease or deep trauma. Can lifestyle changes alone handle everything?
That's where we need nuance. Weil's holistic view is powerful, but it might be too general for some really specific, complex situations. While these principles definitely support healing in almost any case, they might not be enough on their own for someone with, say, a severe genetic condition, or someone needing immediate surgery, or very specific drugs for an acute crisis. His focus is really strong on preventing and reversing diseases driven by lifestyle, which isn't quite the same as managing conditions rooted mainly in genetics or acute injury.
That's a really important distinction. It's integrative, working with medicine, not necessarily replacing it in every single case.
Precisely.
So how does this book fit into the bigger picture of health advice out there? How does ending illness stack up against something huge like, say, the China study?
Weil's approach is definitely broader. Books like the China study are amazing epidemiological work, but they focus almost entirely on nutrition, specifically the link between animal protein and disease, making a powerful case for plant-based diets.
Okay.
Weil completely agrees on the plant-based emphasis, but he adds those other crucial layers, the psychology, the mindset practices, and the specific role of exercise. He looks at how all three interact, affecting things like stress hormones and inflammation together.
So if the China study gave us the what on diet, Weil adds the how for the mind and body as well, putting it all together into a working system.
You could put it that way, yeah. He moves from just showing the data to offering a practical, holistic way to live that supports the body's own power to heal.
All right, so wrapping up this deep dive, Dr. Weil makes a really compelling case, backed by evidence, that we can reclaim a lot of control over chronic illness. The big takeaway seems to be that simple, daily changes.
Focused on anti-inflammatory food.
Right, and consistent movement, plus actively managing stress.
Yeah, those things can have huge measurable health benefits, maybe far more than we usually give them credit for.
So what's the final thought here? What should you, listening, really chew on?
Well, think about it. If the evidence shows that changing your diet, moving your body, and shifting your mindset can effectively tackle major issues like type 2 diabetes, high blood pressure, even immune problems, as the sources demonstrate, it really makes you question things, doesn't it?
Question how?
Have we maybe put too much focus, too many resources on just the pharmaceutical fix? When should we be reaching for the prescription pad? And when should we first try harnessing the power that's already there, built into our daily choices, our routines?
That's definitely something to reflect on. Maybe the next time you're deciding between the quick processed option and, say, taking that walk outside. Thanks for joining us on this deep dive. We hope this breakdown helps you apply these ideas.
See you next time.